Hi, welcome to the 5th edition of NH Dialogues. 4th of February is the World Cancer Day. Cancer is becoming a big problem, creating major crisis in healthcare delivery across the world. And as you know, India cannot be an exception. Something has to be done. People have to be educated for early detection of cancer. People must be educated to seek the earliest possible care and the best possible care. This can only happen by interacting with the experts. Today, I have the privilege of introducing you to 3 of the stalwarts of cancer treatment who are sitting with me. First, I would like to introduce you to Dr. Santosh Gowda. Santosh Gowda is a medical oncologist. What does a medical oncologist do? His job is to diagnose the cancer and treat them with the medicines. And Santosh was a medical oncologist in the US. Currently he is working at Mazumdar Shaw Cancer Center, which is part of Narayana Health City. To my right is Dr. Sharat Damodar. Sharat is a consultant hemato-oncologist. He is a consultant hematologist and also he is the clinical director of Mazumdar Shaw Cancer Center. He runs one of the largest bone marrow transplant services in this part of the country. And Sharat will talk to you about various cancers related to blood. And that is a big problem affecting mainly Indians, children and adults. To my extreme right is Dr. Moni Kuriakose. Dr. Moni Kuriakose is the professor and director of surgical oncology services at Mazumdar Shaw Cancer Center, and he is the chief of head and neck surgery. As you are aware, India is the capital for head and neck cancer, and Moni Kuriakose is an expert in offering surgical treatment for head and neck cancers. Before joining us, Moni was the senior head and neck surgeon at the Roosevelt Park Cancer Center in New York, which is considered as one of the premier cancer centers in US. When we published that on the 4th of February, we are going to answer everyone's questions about cancer, we were flooded with questions. Believe me, we are really flooded. We have picked up few because obviously we don't have that kind of time, and some of the chosen ones are here. And the first question is to Dr. Santosh Gowda. Santosh, Shimul Mandal from Bangladesh wants to know, what is cancer and is cancer curable?
Okay, excellent question. So our body is made up of trillions of cells. That's a lot of cells. Each cell is programmed to function in a certain way, grow in a certain way, and die in a certain way. This particular cell, what we call cancer cell, undergoes changes at the genetic level called the DNA level. That's the blueprint of the cell. And the cell will not die. Not just the process of apoptosis, it won't die. It will not mature. These cancer cells are very immature and dysfunctional, and they'll only know to multiply, grow, invade structures, and it will also spread to different parts of the body and kill a person. That's what is called cancer. With respect to your second part, is it curable? Yes. If it is detected in an early stage, the right time, we can cure cancer.
Very heartening to hear, Santosh, that the cancer can be cured. But there is a hitch. The hitch is it has to be detected and treated early. That is a message, that's a take-home message for you. Next question is for Sharat. Sharat, Senthil from Chennai wants to know, what are the types of blood cancers? How does it vary for children and adults?
Yeah, Senthil, that's a very fair question. Now, earlier, whenever people use the word blood cancer or leukemia, what it's commonly called as, it invariably meant a death sentence. You would have seen a lot of movies depicting this, where this was the diagnosis and it was end of life for that person. But these are basically cancers of the blood system, where you have excess proliferation like what Dr. Santosh mentioned. And we see different types in adults and in children. The good thing about children is that the variety called acute lymphatic leukemia is a highly curable disease in children, and it has one of the highest cure rates of about close to 89 to 90% in children. Whereas the prognosis is not so good in adults, where you have only about 40 to 50% cure rates. So essentially all the types of blood cancers we subtype as acute and chronic. The acute is more aggressive, the chronic is a little slow growing and can progress to acute leukemias down the line. But the high point of this is that if the cancer is detected early and treated at a center where facilities are available to handle neutropenia and the side effects of chemotherapy, then the cure rates can be very high both in children and in adults when they are treated at these established centers.
Thanks, Sharat, because the blood cancer, compared to all the cancers, people, cancer is a bad diagnosis. People obviously not happy about the diagnosis, but if they are pronounced that it's blood cancer, believe me, they feel that that's virtually the death sentence.
Yes.
Thanks a lot for reassuring them. Now the next question is to Santosh. Santosh, Mr. Muhammad Khurshid Alam from Bangladesh wants to know from you how to prevent cancer.
Okay, it's a very good question. Prevention is better than cure. We have all heard that. So certain steps you can take to reduce the risk of developing cancer. It is like, if you wear seat belt and follow the traffic rules, you can reduce the risk of ending up with an accident. Just like that, if you follow certain rules, you can reduce your risk of developing cancer. You can't completely eliminate it, but you can reduce the risk by up to 30%. Here are some of the recommendations that I would say would help. First thing is, say no to tobacco. Tobacco in any form, cigarettes, cigars, smokeless tobacco, chewable tobacco, any form is a no-no. Because tobacco kills people. 1 in 7 smokers die. 1 in every 2 smoker will die of smoking-related illness. Smoking not only causes lung cancer, it causes like stomach cancer, mouth cancer, esophageal cancer, kidney cancer, bladder cancer, and even leukemia. People don't know that. It can also cause leukemia, smoking. So smoking is a biggest risk factor for cancer. So please do not smoke. If you are smoking, quit smoking. If you're having a hard time quitting, get help immediately. The second one is alcohol. First, avoid alcohol, if not limit alcohol intake, because it is proven that alcohol is a known carcinogen, means risk factor for cancer in women. Breast cancer it can cause colorectal cancer, it can cause stomach cancer, liver cancer. So many cancers it can cause. So either avoid it or limit, take it in moderation is a very, very important message that I would like to give. Healthy lifestyle is very, very important. Obesity is a major risk factor for a lot of cancers. People don't know that. You can get pancreatic cancer, uterine cancer. It's a fuel for fire, produces more estrogen. It's breast cancer, colorectal cancer. So a lot of cancers can come from obesity. So get good exercise, at least 20 to 30 minutes a day you need to walk. A brisk walk is very much essential in reducing the risk of developing cancer. Maintain a good weight for your height and take plenty of fruits and vegetables and avoid processed meat, red meat, which is a risk for colorectal cancer, among other diseases like heart disease, stroke, and those kind of things. Safe sexual practice is very important because sexually transmitted diseases like hepatitis can cause liver cancer, and HPV can cause cervical cancer, anal cancer, oral cancer, so many cancers. So safe sexual practice is very important. Get vaccinated for hepatitis B. That will prevent you from getting liver cancer. And also get vaccinated for HPV. If you have anybody between the ages of 9 and 26, please get vaccinated. Whether girl or boy, doesn't matter. You will protect them from HPV. That way you'll prevent the risk of developing cervical cancer, penile cancer, oral cancer, anal cancer, and vaginal cancer. So that is very, very important. And sun exposure. People don't understand that they're getting constant radiation exposure, UV exposure, by being in hot sun. Wear hat, wear sunglasses and sunscreen judiciously. That way you reduce the risk of developing skin cancer, especially melanoma is a deadly, deadly disease. That you have to be very, very careful. And getting screening done and regular health checkups like screening for breast cancer, colon cancer, prostate cancer, cervical cancer with a pap smear, and more importantly, lung cancer. Not many people know that there is a screening for lung cancer. So smokers, anybody with a 30-pack history of smoking between the ages of 55 and 74, are at very high risk for developing cancer. If they get a low-dose CT scan every year for 3 years, you can reduce your mortality by about 20%. So you have to take ownership, you have to be aware about these risk factors, then you can reduce your risk by about 30%.
Thanks, Santosh. It's heartening to hear that we can prevent cancers. Next question is to Dr. Moni Kuriakose. I must admit, I'm a great fan of Moni. I'm amazed at the way he reconstructs the face of patients with advanced cancers. Cancer of the cheek, cancer of the tongue, cancer of the jaw. He does an amazing job. And also, not only me, he has operated on some of the football stars, American football stars, famous ones, because they keep chewing tobacco. They get oral cancer, like Indians. And Moni had the privilege of operating on them. Moni, this is about my personal feeling for you.
Okay.
Let me get back to the business. Vidya from Hyderabad wants to know why mouth cancer is common in India.
Yeah, thank you, Dr. Shetty. That question you answered at the beginning, that India is considered to be world capital of mouth cancer. This is primarily because of the bad habit. Dr. Gowda mentioned about the high-risk habits our people have. And it started off with the chewing tobacco and pan chewing. That with over the time, and also smoking, over the time with health education has come down. But unfortunately, this habit is replaced by gutka chewing. That is unfortunately has gone to the level of school children. And that has really increased the prevalence of mouth cancer. So primarily it's caused by...
One second, Moni, the tobacco, if it is replaced by pan parag and or whatever they eat, can that also cause cancer?
Absolutely, yes. In pan parag, there is the arecanut component.
Yes, arecanut. It's not tobacco.
No, arecanut itself is a primary carcinogen. Carcinogen means a toxic substance which can turn that cell which Dr. Gowda was talking about into a cancer cell. So arecanut is a primary carcinogen. So that is that many people doesn't know about that. People think that this is almost like an appetizer after food. And you can put that sachet of gutka in your pocket and can chew in between work and during work. In fact, some of our IT professionals, they have the habit of chewing that to stay awake. Drivers do that. So this has become really a bad problem in our country. And that is the reason why the incidence, although came down, and the recent years it has really gone up.
It's very, very sad. It's very sad because we see children, especially Moni, in Eastern India.
Yeah.
It is a culture for everyone to keep chewing pan, para, whatever the available, and keep spitting all over the place. But spitting is the least of the problem. The problem is they encourage children to chew those tobacco and arecanut stuff, and that is very, very dangerous.
Absolutely.
It is very dangerous. The next question is to Sharat. Sharat Srivastav from Jammu wants to know whether all cancer curable in chemotherapy alone.
Yeah, so now the initial treatment of most of the cancers will entail three components. It will be chemotherapy, sometimes there will be surgery, and sometimes radiotherapy. And between these three components is where most of the treatment tends to happen. But a subset of cancers, like what I already mentioned, like blood cancer, where it would primarily be only chemotherapy, where the other two may not have a large role to play. In such situations, sometimes patients relapse even after having received chemotherapy. So then does that become the end of the road? No, we have to offer something additional. So in these set of situations for these kind of cancers, there is something called bone marrow transplant or stem cell transplant. So a patient who has a bad subtype of leukemia or relapses after leukemia, the only curative treatment then becomes a transplant where, like any other solid organ transplant, we change the blood system itself. It's not a simple treatment. Initially it was not even available in our country in too many centers. But thankfully now we have large centers all over the country which can offer this treatment. And this is a curative intent treatment. So that's what we should remember, that when we offer this, we are offering it with curative intent. And especially in young people, in children, you want to do whatever you can to help that patient get this set of treatment.
Sharat, the bone marrow transplant, how does it work? Can I be a donor for a bone marrow transplant?
Yeah, so that's a very nice question coming from Dr. Shetty. Now, typically we need a donor, and here we need a HLA matched donor. Unlike kidney donors where you can have relatives with the same blood group donating, here we have to do the HLA typing on the white blood cells, and your best chance of a match is a brother or a sister. But nowadays, with nuclear families, you just have one brother, if at all, or you're the only child, and then you're stuck because you don't have anybody else.
I am lucky, Sharat. I have 9 brothers and sisters.
Yes, sir, you are one of the lucky ones. But nowadays, if you talk to most people, they have 2 children max.
So it's as good as it's like donating blood. Am I
It's
right?
exactly like donating
Okay,
blood.
so I don't need to
There's
lose
no
my
fear
speech, yeah.
about donating. There's lot of thoughts and in people's mind that we are going to cut bone and take it out and things like that. It's just like giving blood. There we collect the red cells. Here we collect the white cells, and we are not even depleting that person. We are giving a growth factor injection, increasing the white cell count, and taking that extra component and giving it. So nothing depleted from the donor, unlike a kidney donor who actually loses a kidney. Here we are taking that extra cells and just giving it to somebody. The benefit there is that we change the blood system, we are also changing the immune system, and thereby these cells can prevent the leukemia from coming back, and that's why it's better than chemotherapy.
Yes.
So these are some misconceptions in our country which have to be cleared, and I'm hoping this forum will help towards that.
Sharat, I have seen some of your survivors. I've seen bone marrow transplant survivors virtually leading normal lives for decades. It's an amazing form of treatment.
Yes.
Congratulations.
Right.
The next question is to Santosh. Santosh, Ratan Kumar Dev from Bangladesh. He wants to know, how does lifestyle of a person contribute for cancer?
Okay. So earlier, cancer used to be a disease of usually old people, like usually people over the age of 60, 65 years, they were getting cancer. But this age now, like, currently more younger individuals are getting, like people in their 40s, in their early 50s, they're getting, cancer. So what has changed actually? It's not the genetics has changed all of a sudden of the human race, right? So something we are doing, something with the lifestyle has to be there. So what are those factors in this lifestyle that is contributing us to develop cancer at an early age? So the main thing is sedentary lifestyle. People are not getting enough exercise, using elevators, lifts to get up like 1 floor or 2 floors, using cars for small distances. Sedentary lifestyle, not getting enough exercise is one of the risk factors. Obesity, eating junk food, lot of saturated trans fat food they're eating, not healthy diet, less fruit and vegetables they're consuming, it leads to obesity. That is the risk factor for cancer. So smoking, think it's cool. No, tobacco in any form is bad, as I told you previously. Alcohol causes cancer. And then lifestyle with multiple sexual partners, unprotected sex, having infectious disease with that will lead to developing cancer. So, and then, people don't realize that, if they're out, in the sun all day, that increases the risk of developing cancer as well. And then people working in the radiation field, if they don't take the proper precautions, they'll be at risk for cancer as well. So these are some of the lifestyle things that you should be modifying to reduce the risk of developing cancer.
Thanks, Santosh. The next question is to Moni. Moni, I was told 30% to 40% of cancers in India is head and neck. Is that true? Is it as high as that?
Absolutely. In fact, about 30 to 40% of head or total cancers are head and neck cancer.
Head and neck cancer.
Yes.
And what percentage of the head and neck cancer comprises what percentage of cancers in US and Europe? Must be a very tiny percentage.
It's only about 2 to 3%.
2 to 3%.
Absolutely.
So the incidence of head and neck cancer in US and Europe is 2 to 3%, and in India it is 30% to 40%.
That's right.
And you attribute that predominantly due to our pan chewing and gutka chewing habits.
Absolutely, yes.
Okay. Moni, the Shubhanshu Haldar from Kolkata wants to know, how do I prevent oral cancer? Is there any vaccine available?
Okay. Before we go into vaccine, we know the cause of head and neck and mouth cancer. It's caused by tobacco chewing and gutka chewing. So that is a primary method of stopping this disease, stop the habit. So then we need to consider other factors. Almost 70 to 80% of the head and neck cancers are caused by the chewing habits. Now coming to the vaccine, yes, it does play a role, but only in a very small subset of head and neck cancer. That's the cancers of the throat region. That is caused by HPV, one of the viruses.
Okay. Thanks, Moni. I mean, at least I am very happy that if you are not a smoker, if you don't take pan and gudkas and tobacco, you don't get cancer.
Absolutely.
I'm okay. I'm sure you all share the same feelings. The next question is to Santosh. Santosh, Poonam from Bombay wants to know what are the early symptoms of cancer?
Okay. So cancer can start in any part of the body. It may be lung cancer, it may be stomach cancer, it may be like bladder cancer. So depending upon the region, say if it's a lung cancer, people may present with, chest pain or cough that doesn't go away, shortness of breath, difficulty breathing. These are the things that they present with. Not necessarily with the same symptoms. It may be spread to some other parts of the body, like the brain. They may be getting like headache or blurry vision. Those kind of things may happen. If it is in the stomach, they may get stomach pain, difficulty swallowing. If it's in the bladder, they may be having blood in the urine. But the key thing that you need to know is, because we cannot mention each and every symptom here, because cancer means it can happen in any part of the body. Anything that's new, any changes in your body that is new, that is persistent, means it is not going away, and progressive. Say you have a cough. You go to the local doctor, they give cough syrup. After a week, after 2 weeks, it's not going at all. It's getting worse, in fact. So that's the time, and if you're a smoker, then it's time to think that something is wrong and get to a specialist. So anything new, persistent, and progressive change in your body needs immediate attention by an expert. Don't, waste time. That's the key message.
Thanks, Santosh. Next question is to Sharat. Sharat, Amlan Roy from Feni, Bangladesh, wants to know what is the life expectancy of a patient who is diagnosed with blood cancer? Yeah. How long they are going to live after the diagnosis of blood cancer?
Yeah, so this was always there. Whenever you say blood cancer, you have this, equivalence to a death sentence. And if you looked at the treatment changes in the last 20 to 25 years, about 25 years ago, you hardly had about 10 or 20% of patients who could survive because of not adequate chemotherapy. Some of the drugs hadn't been invented. But in the last 20, 25 years, there have been a lot of progress in the field of oncology and targeted therapies, newer drugs by newer mechanisms, improvements in stem cell transplant treatments, lesser morbidity rates, have all translated into better survival. So in a subset of patients, we're getting close to 60-70% survival rates from way back where it was 10-20%. And nowadays, even in the relapse setting with stem cell therapy, you're able to cure. So when we say cure in blood cancer, these are all 5-year cure rates. You need to wait at least for 5 years before you start talking cure, because theoretically, even if one cell remains in the body, it has a chance of coming back. Unlike a solid tumor where you could have knocked off it surgically or with radiotherapy, in the blood, it's a liquid system, so if something is sitting somewhere hibernating, it can always come back. And usually, it comes back in the first 2 to 3 years. We wait at least 5 years. Once you've crossed that 5 years, your chances of relapse are really less than 10%. So cure rates are described. It's definitely crossing the 50% mark in most of them, going as high as 60 to 70% in some subtypes. And that's the good news for most patients with blood cancer.
Excellent, Sharat. It's very heartening to hear that 60 to 70% of the blood cancers can be cured.
Yes.
That's a very, very happy news. The next question is for Santosh. Santosh Animesh from Kolkata wants to know, are all the cancers inherited?
Animesh, that's an excellent question. This is a myth. People think that if you don't have a family history of cancer, that you are safe. That is wrong. Actually, 90% of people who develop cancer, they do not have a family history. Only 10% of people inherit cancer with some germline mutation, means mutation that they inherit from the mother or father. 90% of people who develop cancer do not have a family history of cancer. So everybody needs to be careful and go for early screening and examination.
Thank you, Santosh. Next question is for Moni. Moni, Rahul from Delhi wants to know the functional outcome of surgery for cancer of the head and neck. They are obviously worried about I used to have horrifying memories of the outcomes of surgery for jaw cancer back in my good old days when I was a medical student. They used to chop off part of the face, and there was no question of reconstruction. But when I see the kind of reconstruction you guys do, you can barely make out that the person had such an extensive operation. So Rahul wants to know, what is the functional outcome?
Rahul, I think it's an important question, because head and neck serve some of the vital functions of our body, like speech, swallowing, even breathing, and also it gives the identity of a person. Nowadays, we are in a position to replace like with like. For example, somebody lost a tongue, we can replace a tongue with a tissue from other part of the body that can give the shape. We can even connect the nerve so that it can give sensation. We can motorize, means the tongue can start to move. So that can be given. Now, you mentioned about the jaw surgery. There was a time when we removed the jaw, patient had to walk around with a hole on the side of the face. That has completely changed. Now we can replace the jaw, that bone from the leg. We can shape it almost like a normal jaw. Then we can attach muscles to that the jaw, and also we can put teeth back. And
you can put teeth back you remove the bone from the leg and you use that to reconstruct the jawbone, and you put the teeth into it.
Back, yes.
It functions.
Absolutely, yes.
Amazing,
Now,
Moni.
In about a decade ago, all this has to be done in multiple stages. I remember during my training period, all this we could do it, but patients tend to stay in the hospital for almost 3 to 4 months. Now with digital planning, we can precisely plan exactly what the shape and function, and in fact, patient will wake up with a jaw with teeth. Of course, we need to make it secondary adaptation, but we can almost replace every structure in the face.
Excellent. Great news, Moni. Next question is to Santosh. Vidya from Itanagar wants to know, what are the treatment options for end-stage cancer?
Okay. When you say end stage, usually the cancer has already spread to different parts of the body. That's considered terminal stage. Except in cancers like testicular cancer, where even in stage 4 we can cure, and also lymphoma, even in stage 4 we can cure lymphomas. So except those things, most cancers in stage 4, means when they're already spread, the goal is you can't cure it. It's more like palliation. You're trying to extend their lifespan and also alleviate them of their symptoms, whatever symptoms. Maybe the tumor is very big and causing pain, is to reduce the tumor and prevent from spreading and symptom benefit. So the key is to focus on quality of life. When somebody knows that they're going to be around for 6 months or a year, the focus needs to be on quality of life, getting the patient, the family members into confidence and discussing the goals of the treatment, not just looking at the physical distress. People always look at the pain is there, okay, do some radiation, do some chemotherapy, do some pain medication with morphine. But we're only looking at the physical component of the illness. We are not looking at the emotional aspect, what the patient is going through, what the family is going through. That's the psychological, emotional aspect. The social aspect, how am I going to care for my wife? How am I going to care for my kids? What's going to happen if I die? Nobody's addressing that. And the spiritual distress, the guilt that surrounds, maybe I did something wrong. That's why, why is God angry at me? These are all the 4 dimensions of distress that we don't take into consideration. So person with terminal cancer is not about chemo, radiation, or surgery. It is about quality of life. What is that you want to achieve with this particular patient and family? So you have to take them into confidence and give a more holistic care, more integrated approach. That is what a key in treating a terminal patient.
Thanks. Santosh, if I heard you right, did you say that grade 4 or end stage cancer, some of them can be cured?
Yes, sir. Testicular cancer, stage 4. Armstrong, as you are well aware, the cyclist in US, and he was cured of stage 4 cancer. He had cancer that's gone to the brain, actually testicular cancer, that was cured. Lymphomas, Dr. Sharat can agree with me that lymphomas in stage 4 can be cured.
Sure.
So it's not like every stage 4 is a death sentence. So don't generalize people, because you may have somebody with stage 4 lung cancer who would have died, and don't think because they are saying that no, my uncle died of stage 4 lung cancer, don't go to the doctor, it is futile, because not all stage 4 cancers behave the same. Breast cancer people can be alive for years now with stage 4.
Thanks, Santosh. Thanks a lot for the great news. The next question is for Moni. Moni, Malek from Dhaka wants to know about thyroid cancer.
Okay. Malek, thyroid cancer is an interesting cancer. Interesting because this is one cancer where the prevalence or incidence has gone up almost 20-fold in developed nations. This is primarily because of a different investigation we all go through for different ailments. For example, if you have a neck injury, you get a CT scan done, suddenly you pick up a node in the thyroid. And similarly, all these tests and scans identify nodules, which later investigation find out to be cancer. But most of the thyroid cancer presents with nodules in the thyroid. And nodules in thyroid is an extremely common problem, and they are not cancerous. In fact, out of the 4 of us, 1 of us will have a nodule. So it's that common. Now, the job of the diagnosing physician is to differentiate the thyroid nodule from a cancer by various tests. And even if it is diagnosed as cancer, we call it as a good cancer, because the cure rate in high risk or the more favorable cancer is almost 99%. Not many cancers got that kind of cure rate. But however, we have a small subset of high risk cancer that needs much more aggressive treatment.
Moni, I like the way you address thyroid cancer as the good cancer. We thought all cancers are evil.
Absolutely not. In fact, we have cured many cancers, and thyroid is one cancer we can definitely cure.
Thank you, Moni. This is the last question. Sharat, this is Yogesh Sharma from Yamuna Nagar. He wants to know, I am Hodgkin lymphoma cancer patient. Tell me what treatment option I have.
Yeah, among the lymphomas, the Hodgkin's subtype is actually the better subtype. You have 2 subtypes, Hodgkin's and non-Hodgkin's. And a stage 1 or stage 2 Hodgkin's has very high cure rates, like how I mentioned about leukemia in children. So you get 80-90% cure rates in the Hodgkin's lymphoma if it's early stage. Even like Dr. Santosh mentioned, stage 4 also has a curative intent treatment of close to about 50 to 60% of patients. That's because there have been advances in chemotherapy. You can use radiotherapy when there are bulky disease. There are newer monoclonal antibodies also which have come up even for relapsed lymphoma, both in non-Hodgkin's and in Hodgkin's disease. And this is not that these are all drugs which are all overpriced, only available in the US. They are all available in India. We have the advantage of biosimilars, generics, which works just as well. So this is what is making cancer treatment more and more affordable also to our subset of patients. So that way it's very good news for a lot of patients. That's the reason why sometimes we even use the terms like good cancer. If you had to have a cancer, you have something like thyroid or CML or testicular, which are things which have very high cure rates even when they are stage 3, stage 4.
Thanks, Sharat. And the last question for you, Sharat. You have one of the most sophisticated bone marrow transplant center, one of the largest bone marrow transplant center in this part of the world. Now, we know bone marrow transplant is very expensive. What if somebody can't afford the high cost of bone marrow, if he comes to you, can you help them?
Yes, sir. We've realized that, since this is a curative intent treatment, it's the responsibility of us as doctors and the medical community to try and push and pull whatever we can do to help these patients. A lot of them would be children. You can't be turning them away for want of finances. So as it is, at a lot of centers, including our centers, we've been able to come down on the cost by, providing things at more subsidized rates. In addition, we go out of our way to seek help from a lot of NGOs, organizations, from the government, funding from the hospital for drugs, catching whoever we can to fund these patients who are genuinely in need of these treatments. And we know that when we are offering it with curative intent, we should give that person that chance. So we are lucky that at Narayana Health and the Mazumdar Shaw Cancer Center, we are lucky to have people who come forth and help these children and adults, because sometimes livelihoods depend on them, and we are able to push these kind of treatments even at half the cost, which is all we kind of ask from the patient. We organize all the rest of the funding from various sources to help them out.
Thank you, Sharat. Sharat, I'm very happy that diagnosis of cancer is not a happy news.
Yes, sir.
But the good news is that we are privileged to have extremely bright and extremely skilled doctors like you all, and more than anything else, you have given a very clear message that if you have financial difficulty and you suffer from cancer, don't worry, you come to us, we'll be able to help you.
Yes,
that's a great news. Once again, thank you very much for switching on to NH Dialogues, and I hope you're all benefited by this information, and looking forward to seeing you once again. Bye.